Cancer patients in their journey will receive pain medications which can leave them lethargic and even constipated. In addition, they will be prescribed additional medications to counter the lethargy and constipation. Often, due to their treatments, they experience terrible nausea. This, of course, is met with yet another script. Depression, anxiety, sleeplessness are all present and combated, each with additional drugs. Again, each of those pharmaceuticals comes with their own unique set of symptoms. What if I told you there was a safe, all-natural medication available to these cancer patients that would reduce their pain, calm their anxieties, restore appetites, and yes, even alleviate many of the symptoms that come with the poisoning effect of their chemotherapy? The secret is not just to rectify these horrors, but to never have robbed the patient of their quality of life with the hodgepodge chemicals in the first place. As early as 2700 BC, there are written records of the cannabis plant being used in China by the Emperor Shang Nung. The emperor was considered by many to be the father of Chinese medicine. He is also credited with the use of ginseng and ephedra, which, as we know, are widely recognized and used even today. The cannabis plant, or medical marijuana, is a natural alternative to many of the toxic, expensive chemical brews prescribed to patients suffering with all forms of cancer. It's also something that people are a little leery of. But I would like to share with you some cases, and we will look at some of the various forms in which the cannabis plant has been used successfully in helping these and others to maintain, and in some cases gain, the quality of life. Perhaps your mind, as mine, can be changed about its use after seeing these positive attributes. So let's learn a little something. As a pain relief, the University of California at San Francisco has completed studies which compared the use of cannabis and the chemical compounds found within to opiates traditionally used to combat pain. Pain levels were found to be reduced by 20 to 35% when opiates were paired with the naturally occurring herb. In addition, many of the side effects of opiate use, such as constipation, were completely alleviated as levels of the chemicals being dosed were reduced. Even in the absence of opiates, in the complete absence of opiates, pain relief was experienced in all three categories: neural, somatic, and visceral. Anxiety is another big enemy of the cancer patient. Anxiety comes in many forms, but the two most easily recognized are pre-procedural, and that's basically where a patient experiences anxiety leading up to what has traditionally been a miserable experience, and then there, of course, is just good old-fashioned anxiety. And this can produce itself as everything from just heart racing to all-out panic attacks. The calming nature of CBD, one of the chemicals, or cannabidiol in the plant, can go up against Valium or Xanax any day of the week with really no documented chance of addiction. Interestingly, the very same plant can combat depression just as easily. Nausea, another frequent companion to the cancer patient, has been shown to be quickly relieved with the administration of medicinal cannabis. Treatments of chemotherapy, which is nothing more than systemic poison, leave the individual as sick as if they had consumed any other poison. The American Cancer Society, a known authority on the subject, addresses the obvious benefits to such a remedy, regardless of its legal status. Found that interesting. Like nausea, the loss of appetite can accompany cancer and its treatment. Again, the ACS, among others, preaches to the wonders of the compounds in the cannabis plant. A patient who otherwise would not be eating will have a reduction in nausea, an increase in appetite, and subsequently an increase in their food intake. A well-nourished patient will have the strength to better fight that which is trying to kill them. Keep in mind, the treatment is trying just as hard as the disease. To date, there have been no studies, not one, to show any negative drug interactions, which means the herb can be used in conjunction with necessary medical treatments. There have never been not one study that showed users can develop a chemical dependence. Yes, they can become tolerant, and some may even become emotionally dependent. But physically, they just haven't shown that. Additionally, with regards to safety, there's not been one case of overdose. The chemical compounds just don't work that way. So really, in conclusion, with all these attributes by any other name, how would you feel? Would you have reservations? Personally, I fought the idea of legalization of all forms of cannabis, fearing the worst. Knowing now, however, the good that it can provide these patients, why would we not give its credence due? For argument, Pfizer develops a pill that reduces pain, battles the symptoms accompanying chemo, anxiety, depression, nausea, loss of appetite, and many other things, all with no apparent downside. We would all be fighting to make this happen. Let us learn as much as we can, and let us make this happen. Anybody have any questions?
No.
Good. Let's do this.
Thank you.
Thank you.